A concussion is a mild traumatic brain injury that can occur with or without a loss of consciousness. A concussion can occur from a blow to the head or body, which causes the brain to move within the skull. Car accidents, falls, and sports are some of the most common causes. However, everyday events like sibling wrestling or playing on the playground can also be a cause for concern. Every concussion is unique and usually presents with a multitude of symptoms that fall into 6 subtypes. These subtypes, or trajectories, include cognitive fatigue, vestibular, ocular, post-traumatic migraine, cervical, and anxiety mood. The symptoms from a concussion, such as dizziness, headache, trouble concentrating, anxiety, and imbalance, can occur independently or simultaneously. If you think your child or athlete has sustained a concussion, the best thing to do is to remove them from the activity that they were doing. On the field, look for difficulties with balance or confusion. Red flags include loss of consciousness, vomiting, seizure-like activity, or trouble moving their extremities. If a concussion is suspected and if symptoms are persistent beyond 3 days, we recommend bringing them to a healthcare provider who specializes in treating concussions. The current Berlin guidelines advise 24 to 48 hours of relative rest post-injury with gradual resumption of normal activities as tolerated. Early aerobic exercise at a sub-maximal level is also recommended under the supervision of a trained healthcare provider. Research shows that a multidisciplinary approach, or team approach, is essential to promote the best recovery. Our concussion team at Burke consists of physical therapy, occupational therapy, speech therapy, and physiatry, with referrals to outside providers such as neurologists, neuro-optometrists, neuropsychologists, and social work as needed. Once the patient is evaluated by the appropriate team members, our first goal is to get them back into school or work. Different accommodations such as half days, extra time for assignments, or eating lunch in a quiet area may be considered to promote recovery. If returning to a sport is the goal, the patient must first be back at school and symptom-free. We then follow the Berlin 6-step return to sport protocol after performing an extensive 3-phase exertion assessment developed here at Burke. Once the patient can progress through all stages of the protocol 100% symptom-free and is ready to return to play, a New York State mandated clearance note is then required by a physician or neuropsychologist. At Burke, we treat individuals of all ages who may have sustained a concussion. Upon receiving a prescription, they are seen within 3 days and an appropriate treatment plan is developed based on their specific goals and needs. We also offer educational lectures to students, parents, coaches, and other community members to help promote concussion awareness. Concussion patients can be treated at 5 of our outpatient satellite sites: White Plains, Purchase, Mamaroneck, Yonkers, or Somers. Our main goal is to see our patients succeed in school, work, sports, and life as soon as they are ready. Remember, never hide an injury. Responsible players always report a concussion.